Good morning, everyone. My name is Allison. I am a nurse practitioner at the University of Iowa Hospitals and Clinics. I work in the medical intensive care unit where we have been taking care of the sickest of the COVID patients since about the end of March, beginning of April. I've heard from them this morning. I have a handful of COVID patients ranging anywhere from Optiflow to 2 on ECMO. So it should be a pretty busy and interesting day. So real quick, I'm walking into work. I get to take a beautiful little 10-minute walk into work, which is nice. It kind of helps me clear my head, get ready for the day, have some positive thoughts. I listened to some cheesy music in the car this morning, anything to keep your mood up, nothing too serious, nothing to make me feel any more feelings than I already have these days. Okay, so we got all of our PPE on and we are going to see our first patient of the day. I got a face shield on, I got a surgical mask on, I got a little scrub cap on to protect my hair and to protect my ears so my ears don't get sore. At the end of the day, I got a gown on. This is what we wear for every COVID patient we take care of. If our patient does not have COVID, we still wear a face shield and a mask. And if our patient is having some aerosolizing procedure and they have COVID, we wear an N95 mask, which is what you hear about on the news sometimes. But it's pretty tedious to put all of this stuff on for every patient every time. It really slows the care that we can do down quite a bit. Everything takes longer than it used to. I think back to 6 months ago when you could just walk into a patient's room, and I really miss and kind of long for those days where you could just walk into a room and say hi and have a patient see your face. No longer can we do that now. We are protected head to toe, both to protect the patients from us and us from the patients, et cetera, et cetera. Hey, it's Allison again. We are done rounding for the morning, so I thought I would give you a little tour of the MICU and discuss a little bit more about some of those advanced therapies that we are doing for some of our ECMO patients. I'm standing outside of my patient's room who is on ECMO, which is an advanced therapy to help the lungs. We use veno-venous ECMO here in our medical ICU, and really what we're doing is replacing the lung function for the patient. We have a big machine in there that circulates the blood around outside of the body that helps oxygenate and remove some of the CO2, which is a work that the lungs would typically do for you when they are not so damaged. However, ECMO patients tend to get some pretty severe lung damage, so sometimes they need some extra help doing this, and that's what ECMO is. We have a specialist who sits outside the patient's room and helps monitor the machine. So this patient not only has a nurse of their own, they also have an ECMO specialist of their own, so it takes quite a bit of resources. Side of the unit is COVID patients recovering from COVID, patients who actively have COVID, all needing advanced lung therapy. I think so many of these patients will end up with long-term side effects, and I think that's what you don't hear about. Yes, patients are doing better. Yes, people don't always die when they're on the ventilator like we initially thought 6 months ago, and yes, we have better ways to treat them and we're understanding better how to ventilate them, which is all good things. But I think what the public needs to realize is that they're still going to go home debilitated. They may need months and months of physical therapy and rehab. They may have permanent lung damage forever. They may have mental health issues forever. And that's something that we need to think about. And that's one of the reasons why we should really take things seriously is, maybe less people are dying now than they were 6 months ago, but that doesn't mean that everyone's okay, and that doesn't mean that it's a non-deal, that it's a no big issue, and that you won't be dealing with it for the rest of your life. And I think that's what I wish people would realize is we don't know. We don't know what your lungs are going to look like 10 years from now. We don't know what your heart's going to look like. We're finding out more and more about people's hearts and what's that's going to look like 10 years from now. And just because you're not dead doesn't mean your life isn't changed forever.
I really hope you got to see how much extra effort it takes to take care of these patients, the extra gowns, the extra masks, the extra time, the extra bodies it takes to take care of these patients. The pandemic is still here. You know, we're still wearing all these extra pieces of equipment, all these extra masks, all these extra face shields, and we can't see an end. Unfortunately, I live in a state that didn't shut down as much as I wish it would have. And, you know, not everyone believes that this is real. You know, so many people still just think this is the flu and we're overreacting and, you know, we need to go back to normal. And as much as I want to go back to normal, trust me, I desperately want to go back to normal. I think everyone I work with wants to go back to normal. We still have to be safe and respectful of each other. Please wear your mask. Please protect those around you. That's the patriotic thing to do. It's the right thing to do. It's about being a good citizen. So please take care of yourselves. Take care of each other. Please know that this is very real, and we will do everything we can to continue taking care of you. But we really want citizens in Iowa and citizens across the U.S. to do the right thing and wear a mask, social distance when possible. And if you have to get together with people because you're getting lonely and tired and we know you're burnt out too, go outside and do your best to stay away from people. Thanks so much, and I hope you all stay well and healthy.